Hi, Dr. Bindiya. How are you doing?
I'm great, thank you. How are you, Moses?
I'm good, and thank you for joining me here in Dubai to discuss our next podcast on women's health. This one is called "The Modern Woman and the Menopause: Power, Pause, and Possibility."
Thank you for having me over. I'm very passionate about this subject, and to be very honest, I don't even like to call it menopause. I've started using the terminology called midlife rebalancing of these women. And that takes me back to 2016 when I had moved from the UK to Abu Dhabi. And I realized I was working in a previous organization where I realized that, most of the focus on women is about them making babies and delivering. And very few people are really touching upon what a woman in a midlife goes through. So I was very instrumental in setting up these services in the previous organization where I was working, and now in Yas Clinic Hospital at Khalifa City.
That is very true. I think many people have said that menopause is one of these things that gets ignored. It's not. It's not. It doesn't have the fancy attraction of fertility or PCOS or endometriosis, and it's one of those conditions that is quietly being forgotten, and yet it affects almost every woman who has completed her family and is now is now advancing to a new chapter in their life.
Absolutely, and you wouldn't believe that, as per the medical evidence, 2025, we will have almost 1 billion women who will hit menopause, and which makes up about 12% of the global population. But the good news is that momentum is, growing towards raising awareness, women coming in and asking for help.
No, that is true. And you've touched on, and I feel almost a bit old fashioned, but you've touched on the word menopause and maybe the alternatives. But just the word can stir up many emotions. Let's start with the simple. What exactly is the menopause, and how do women know that they're entering it?
So, by definition, menopause is when a woman has stopped having her period for 12 calendar months. The average age of menopause, based on the medical evidence, is still 51 years, as is quoted in textbooks. However, my experience is that time is not far when the textbooks would be rewriting that the average age of menopause has actually come down. Having said that, I would like to also speak about a condition where women before the age of 40 stop their periods and never have it beyond that 12 calendar month cutoff. That is less than 1% women, and is called as premature ovarian insufficiency. And as per the regional data of Abu Dhabi, I would say that this percentage is as high as 5%, which is much higher than what is, much higher than less than 1% that we know of.
Actually, I think that's where both your world and my world kind of cross paths, because infertility, I do deal with quite a number of women with premature ovarian insufficiency who have either are perimenopausal or approaching the menopause before the age of 40. Which leads me to, I think, my second point, because you've mentioned these small group of women who are approaching the menopause under the age of 40, but even those who are approaching the menopause, why is it that so many women feel unprepared for the menopause, even though it's something that every woman eventually goes through?
That's the question I have been asking myself as well. I would say partly the awareness. When it's the education, educating women, talking about it, the more they're aware that there is something, this condition that exists, and it is not a stigma, it is to talk about it, to get help. Even just talking, and I was speaking to some of my colleagues in the hospital, and what sticks with me is somebody just asking them, are you all right? Do you need help? They don't feel lonely. This is one thing. Other thing I would say in the medical body as well it's always encouraging to, when you're talking to a woman at the age of around 40 and above, it's good to just throw in leading questions like, are you getting hot flushes? Are you getting night sweats? Are you getting irritable, brain fog? I remember in 2017, I had a patient and she has moved back to her home country now. She came in with generalized abdominal bloating. And based on, the North American Menopausal Society, British Menopausal Society, if we have looked into everything, that is no irritable bowel syndrome, no endometriosis, you can very safely say that bloating itself could be the only symptom of menopause. And what I did was, and I'm so glad I could put a finger to her condition, she had been from pillar to post and finally mentioned that it could be, due to menopause. And then when I addressed it with lifestyle changes and lots of other things, it helped her. And sometimes only joint pain could be the only symptom of menopause. But we think about it less. We always think, oh, it could be a rheumatological problem. It could be a problem with the bones. Very rarely have I heard anybody say, have you thought about your hormones changing and affecting and leading to joint pain?
That is very interesting and what you're really touching on is the wide range of symptoms people can have. It's not just the hot flushes, the mood swings, but it's this joint pain, bloatedness, changes in their bodies as the hormones change. Do you think that menopause is considered a taboo subject, a topic in conversation?
I think that's the mindset. I would say yes, the mindset across the globe. Is they don't want to talk about it, partly because of the taboo, partly also of a dismissal attitude. I have often heard, in my clinic when I was in the UK, I was doing a pre-op ward round and we were doing a hysterectomy and a bilateral salpingo-oophorectomy for a patient. I think I was in Dorchester that time. I had a husband of that patient say, thank you, doctor, you'd actually be doing me a big favor. And I said, why? They said, my wife always goes crazy. Now, I feel that is a very strong word to use. It's very important to understand what really is making her crazy. Does she need support? If we take it positively, we try and understand, yes, it's not a disease. It's actually a transition. Why is it that we celebrate puberty as a biological transition? Why we can't use the same kind of a positive connotation to a transition for a woman from her reproductive age to a midlife, and let us, in fact, let her celebrate and let us be a part of that celebration. Let us help her to rediscover herself. So I would say, yes, let's not take it as a taboo. It's not a taboo. It's a part of biological process. Let us help her rediscover her life through this.
Actually, that is a very interesting way of looking at it, which I'd never thought of. When you say people celebrate a young girl going into puberty, which is true. I come from a family of 7. I have 7 sisters, and I almost remember there was kind of this celebration with all my sisters when they went into puberty, with my mom talking to them about their periods, and there was this celebration that they'd become adult women.
Yes.
And yes, you don't get that similar celebration of a woman moving from her fertile years into a post-fertile years in her life, which should be a celebration again. And I've never thought of it in that way.
I'm hoping that this message goes out to as many women as possible, as well as, I would say, their partners and husbands, so they can feel supported.
That's very true, because yes, it would be good for more husbands to understand their wives and to understand the changes their wives are going through as they transition from their fertile years to their post-fertile years. For the many husbands out there, or many brothers or uncles or cousins. What are the most common myths you hear from patients or their partners about the menopause?
Most people have not spoken about it. They just say, oh, she's having one of those mood swings of hers. And in fact, very interestingly, the other day, I'm doing my, as you're aware, I'm doing my MBA from London Business School. And while at lunch, I had a female cohort member say, oh, I was getting crazy. And my husband just said, oh, are you, is it that time of the month? Or are you getting old and hitting into that crazy part of the life a woman gets into? And I was like, I feel very passionate about it. I said, you should have, said to him, this is your time to support me, understand me, why I feel this way. So the myths are, it is, don't dismiss it. Hear them out. Maybe they need to be heard, and that would solve all the problem. And bring them to a gynecologist who's, who understands these women, who has a passion to find solutions for these women, and be as a part of the consultation as well. So you can support. It's not just tell her to, okay, go visit a doctor. No, be there. Like, when a couple are planning to embark on a journey of making a baby, the two together should actually come in to understand, to support her new journey.
Yeah, listening to some of the comments about that the women have said about what their husbands say when they're going through, when they're having these hot flushes or symptoms, I'm thinking those husbands are lucky. I would normally get a slap on the back of the head if I said that to my partner.
I hope she hears that.
But how can women start having open conversations with their doctors, with their families, or even their friends about what they're going through?
So, in my own little way, what I have been doing is raising awareness by word of mouth. So, when I do get a patient in my clinic, I definitely touch upon some very common things, or I put out a leading question and I say something, is there anything you want to talk to me about that's been bothering you? I have done quite a few Instagram posts, and I did have the opportunity to be screened for a TED Talk through London Business School, which unfortunately I could not, continue doing that for various reasons. And the topic of my talk was #menopause. Is it time to, remove the shame and rediscover women? So in my little way and through this podcast, I hope many women across the world can approach their doctors and feel free that, yes, that we as a medical body should support them to open up to us. And then, it's a multiplier effect.
I can understand, and I think it's more about being sensitive, listening, trying to understand more about what women are going through. Or it's not only for us medical professions, but even family members, husbands, brothers, friends out there. Just say being sensitive to what a woman may be going through, these changes in that, which could be scary for them as well.
Absolutely. In fact, if I recall correctly, UK has appointed a menopause champion a couple of years ago.
Yes, I believe so.
Yeah, and also there was a report by Corn Ferry Company, and unfortunately what that report mentioned was 50% of the employers do not understand what women go through menopause. So it's, yes, friends, family, doctors, but even the employers. Currently, women get maternity leaves. I think in the UK it's still 6 months of maternity leave, but I have still not heard of menopausal leave, which would be, something for various employers to consider. And also, I was thinking about, like, there are breastfeeding rooms in various hospitals, lactational rooms, how about having what is called as menopausal hubs in the, at workplaces? What that means is, let's say a woman is having that time that she feels she's not in control of her emotions, or she gets a hot flush, or she's anxious suddenly, she could just go to one of those menopausal pods, or rather, like menopausal pods, and just de-stress herself and start her work again.
Yeah, you talk about these pods and menopausal pods, or a place for go through. She's having these hot sweats or mood swings, but what is actually happening to a woman's body for her to have these hot flushes, mood swings, and sleep? What is actually happening underneath to cause these effects?
So, at this point of time, I feel one of the few times that I can say proudly, women have lots of hormones in their body. I know men are lucky. They just have two hormones, so they have a bit of a monotony in their life. Because of, I would say, hormones like follicular stimulating hormone, luteinizing hormone, estradiol, thyroid stimulating hormone, there's a cocktail of hormones, and suddenly they go all out of sync.
So you're talking about really the sex hormones, because men do also have the others, like the ADA, thyroid stimulating hormones. They have, but what you're really talking about here is the sex hormones. Is that
And
correct?
also, what I'm trying to say is that these hormones cannot be controlled. So how these hormones are going to interact, there's a balance. So during the reproductive age of a woman, there is a balance. At first, the follicle stimulating hormone rises, makes a follicle, then that comes down, and then the luteinizing hormone rises. So that synchrony is broken.
Yeah.
It's like when there is no synchrony between so many hormones, a woman can get these hot flushes, and also the sensitivity factor that kicks in. So put it this way, yes, you have the hormonal effect. They tend to feel more hot because of the skin changes, the blood vessels dilate a bit more. And coming to the brain fog, out of the blue, the brain fog kicks in. Again, due to the hormones. And also I noticed, the awareness. Sometimes women, they feel, oh, I'm getting a hot flush. And then suddenly their brain goes into a freeze mode. But largely it's you can say the dynamics between the hormones. I always say two people, the best analogy I can give is, two people can be very good people, but when they're put together to do a task, they may not get along well. So same thing with the hormones, I say.
How do these hormone changes also affect a woman's mental health, causing things like you have spoken about, the brain fog, anxiety, or even leading to depression?
Yeah, one of the very key hormone in a woman's body is the estradiol level. In fact, estradiol level is also considered as an anti-inflammatory. There are lots of receptors for estradiol in the body, the brain, the bones, the heart. And when these levels start going down, the cognition or the memory gets affected, the heart gets affected, and the bones, in addition to, of course, all the various supplements, these estrogen receptors are present everywhere in the body. And when they start depleting, it affects the mind, the memory, the bones, the heart, you name it, joints.
But what about the physical changes to a woman's body? A lot of women talk about weight gain, or pains in their knees, in their hips. Is this inevitable? Can any of these things be changed or managed?
So some of the menopausal women never even realize they've gone into menopause, and they realize it much later. Oh, they stopped their periods, but they feel very up and about, and no joint pains, no belly fat. They just feel the same. On the flip side, there are women who are very, very aware that they're going into menopause. Suddenly they feel that their clothes don't fit well, and they have joint pains, they have swelling, they're getting more irritable than before. They're forgetting things. For example, they've got their glasses on their head and they keep looking for it everywhere. It doesn't affect everyone, but it does affect quite a large population. Now, what they can do about it is, obviously, we always say healthy lifestyle for everything. Eating healthy, if they have been enjoying their glass of wine a lot, then maybe cut down on alcohol, cut down on smoking. Physical activity is very good. And I would say among the different kinds of sporty activities, swimming is by far the best. It's releasing the endorphins, keeping you happy. It's good for the joint pain. it's a very good exercise as well to maintain your weight, because weight gain does kick in. The fat composition and the water composition in the body, due to various hormones, it starts, so it goes like less of water, more of fat. So just being very mindful, and of course, over the age of 40, what I have advised this is my take on based on the medical evidence and my experience, it's always good for women to have supplements like, calcium, magnesium, vitamin D, multivitamins, because none of us are having exactly the right amount of food to give us the right amount of these supplements. For example, these women require at least 1,000 milligram elemental calcium per day. So the best way is have it with your supplements, like calcium tablets.
So you've spoken about supplements and lifestyle changes. But what are the medical treatments out there that are available for women? And how will a woman decide on what is the best type of treatment for her?
So I'll make it very simple. There are 4 pillars for the treatment. We touched upon the lifestyle. There's something called hormonal replacement therapy, or the HRT, or some people even call it the MHT, or the menopausal hormonal therapy. And I fear that not only are the patients petrified of taking hormonal replacement therapy, many of my colleagues, when I discuss with them, they're like, oh, no, it causes breast cancer. And I would like to take this opportunity to tell women, 1 in 8 women in their lifetime anyway have a risk of breast cancer. A careful assessment should be done by your menopausal specialist, doctor, so that, it's the right kind of a patient is picked to give hormonal replacement therapy. It shouldn't be that HRT is bad for everybody. In addition to hormonal replacement therapy, I also talk about cognitive behavioral therapy. And there's medical evidence to say that cognitive behavioral therapy has been helping many women with their anxiety, with their brain fog. And then there is a holistic approach as well. You may have heard of things like NAD infusion, hyperbaric oxygen therapy. There is no clear evidence whether it helps or not, but definitely there's evidence to say it doesn't harm these patients. So for example, NAD infusion. NAD is a chemical which is present in a body which decreases with age. And if we support our women with this NAD, they do feel very vitalized and full of energy. And currently what I'm doing in my practice is I've done a validated questionnaire where I give it to my women, to my patients before starting NAD. And I tend to offer 4 infusion therapies, so 1 every week. And then at the end of the 4th week, I give them another questionnaire to grade them. Has it made a difference? And I'm auditing this in my practice. And I notice NAD infusion is also giving them energy. Fatigue, not being able to sleep, is also 2 very common menopausal symptoms, and it is being addressed by hormonal therapy, lifestyle, cognitive behavioral therapy, NAD infusion, hyperbaric oxygen. Though it's not a licensed treatment for menopause, but it is giving them the boost to their energy.
No, that's great, and also hearing about other alternatives. I remember when I was still a junior doctor, there were two big clinical trials that really shaped my approach in managing women going through the menopause. I think one was the Million Woman study.
Yes.
And the other was the
Women's Health Initiative.
The Women's Health Initiative. And so I wonder now, based on evidence-based medicine, what are the real risks and the real benefits of HRT for women?
So it takes me back to when I was in Northwick Park Hospital in London, and there was this big The Y study had been abandoned because, the risk of heart disease, they said, and the risk of women having breast cancer is going up with the use of hormonal therapy. Would you believe it? The same study has been revisited, and what they have identified is actually hormonal therapy is good for women's heart, it's good for their bones, and it's also good for their cognition, memory. It's helping women with diabetes. Of course, there's always a pros and a con. The cons are that there is a slightly increased risk of blood clots, but this risk is not a rise in the absolute risk. It's a relative risk just above the background risk. Again, coming to the risk of having breast cancer, it's not an increase in the absolute risk. It's only a slightly increased risk of having breast cancer. But having said that, there are so many other risk factors that we are exposed to with for breast cancer, not only the hormonal therapy. I would say it's a bit of an overhype.
Osteoporosis, thinning of the bones. And if these women had a fall and they broke their hip, it actually reduced their lifetime expectancy by about 5 to 10 years if they broke a hip bone. And again, also the symptoms, the quality of life for women who are having hot sweats, mood swings, anxiety, sleep deprivation. These can substantially affect their quality of life compared to women who are actually taking HRT.
Absolutely, Moses. And one thing I would like to tell women, and I tell my patients in my clinic, life is a trade-off in itself. Do we ever get 100% of what we want in our life? And same thing with hormonal replacement therapy, a detailed risk assessment, and you have to take a trade-off. Do you want a horrible quality of life but not have any hormones, although you're absolutely, well, I wouldn't say absolutely, you're safe to take it? So it's all about a trade-off. And something very interesting now, there are different forms of hormonal replacement therapy. Patches, gels, creams. It's not only just the tablets. And then again, we have to remember one thing. Let's say a woman has had her uterus removed for some reason much earlier. She can just take one type of a hormonal replacement therapy, that's the estrogen, and the patches, which is a transdermal preparation. That is one of the safest forms of HRT. I would even sometimes say, it's a higher risk of dying in a road traffic accident than dying of taking HRT.
Yeah, very, very true. And it's about understanding what the real risk is as opposed to the relative risk as compared to people who are not taking HRT. And so that is something which it's even for me as a doctor sometimes difficult to understand, and it's more because it's more of a statistician's expression of what people's real risk and what their relative risk is. But for those women out there who are concerned about using HRT, are there any natural or holistic remedies that you can recommend that can complement or be used as an alternative to medical therapies?
Yes, absolutely. So unfortunately, HRT doesn't appear to be the best alternative for many patients once a risk assessment is done. But I don't want them to lose hope. Healthy lifestyles, sporting activities, holistic therapies, as I alluded to earlier, yoga and herbal remedies. But in herbal remedies, I would take it as, with a pinch of salt, because they have not been very tried and tested, and there's no medical evidence. For example, some patients were using black cohosh, and black cohosh turned out to be damaging the liver. But red clover is one of the herbal therapies. And again, then it depends on their symptoms. For example, some patients complain a lot of vaginal dryness. They can just take vaginal creams for it, which is like very, very low risk. In fact, it hardly gets, it bypasses the first pass metabolism, which means it's not going into the liver. So it's also targeting the right symptoms of these patients. And even for those who are qualifying to take HRT, I always do incremental increase of the duration I give it. So, for example, I let them try for 4 weeks, then they come back to me. I do a risk assessment again, high blood pressure. Are they feeling comfortable with it? Sometimes this can also lead to appetite changes and bloating. Some patients ask me, oh, will I put on weight? No, it's designed to help you to balance the hormones. So these are some of the things that I would tell patients who can't take a full-blown HRT.
Now, actually, and this is almost like a personal interest in this. I've more recently in my personal life, I've been exploring what I'd call Eastern medical philosophy. So you've spoken about yoga, but actually I've got an increasing number of patients who come to me asking me about things like acupuncture. You've spoken about yoga. Here in the Middle East, there's is it called
hijama therapy?
Hijama therapy. So lots and lots of women are asking about alternatives to what is considered traditional Western medicine. What do you have to say? What is your experience with the success or acceptability of these kind of therapies for women?
So that's a very interesting talk about acupressure, acupuncture. I say it's not harmful. Why not try it? Sometimes that is your way to relax you, and you feel better. For that matter, even having a de-stressing massage, that is also known to help. So, but to put a number to the success rate is very variable. So, for example, some people don't like hijama therapy, but some like it, and it's also what you believe. And I try to put in a self-fulfilling prophecy to my patients when I'm counseling them for alternative therapies. So what I mean is I try and build a positive image for it. So, for example, swimming, acupressure, acupuncture, I build it up to them. Aromatherapy, for that matter, that this is going to relax you. Why don't you try it? And there is a positive correlation that, aromatherapy. And I personally tried aromatherapy on myself and with a positive expectation, and it worked. So this is very important, that it doesn't harm the patients, but go with a positive expectation. Don't say, oh, it hasn't helped my friend, so I'm sure it's not going to help me. No, always go with the thing, it's not harming me, so definitely I should get the benefit out of it.
More or less like try it, and if it works, excellent.
Exactly.
If it doesn't, there are alternatives.
Yes.
So this now leads me to my next point. Menopause used to be seen as the end, but many women now are starting to see it as a beginning. What's changing in the way we talk about the menopause?
So if you see, the life expectancy is much higher these days. The average lifespan has increased. Women's desire to embark on their journey of procreating is much later. So I would say that it is still the beginning. Like, some women are planning to have their babies at 45. And in fact, I see even the 20s who are having their periods regularly, they start complaining of, oh, I'm stressed out for little things. In fact, even school kids, sometimes you ask them, they say, oh, I'm very stressed out. So stress, anxiety is not only is not the only thing, is not related only to menopause. It's a mindset, I would say. So definitely it is the time to rediscover yourself. I would not say it's the end. It's the start of your new chapter and journey in your life, and embrace it.
So what would you say to a woman who feels she's losing herself during the menopause?
And I do get these questions from my patients, and they say that, I don't feel I'm the same person again. It's very important to give time to these women. And not only as a clinician would I say, I would say to friends and families and even the employers, if especially the employers, there should be somewhere that says that if a female employee is not performing herself and she says she doesn't feel herself, she should be encouraged to talk about it. What is it really she doesn't feel about? Is it she feels low, she feels underconfident, she feels she's not performing as well as she was earlier? Does she feel that she needs some time off work or time away from the mundane chores of her family life? So not feeling herself is a very broad term. And I have experienced in my clinic, when I tell my patients, what exactly do you mean by that? Talk to me. That talk to me itself lets a guard down. And I've had some of people at work when I say, you look tired and run down. And they said, oh, it's very difficult to explain to people why I feel that way. I say, no, open up. I want you to talk to me. And they say, thank you for listening to us. Just that time for these women, what they're going through, helps them a lot, and that barrier, that ice breaks, and they can come back and to you, and you can guide them in various other directions, like, for example, psychological counseling, life coach advice. And in this very fast-paced life, people are not getting time to, talk about their emotions.
You're right. I think it's about supporting them, listening and supporting and providing a safe environment for them to discuss these changes, and also how to navigate through these changes with maybe more time to complete an assignment, maybe turning up the air conditioning in the office. Opening simple things which may make a work colleague's time at work easier and better.
Absolutely. Just this little thing, are you okay?
Yes.
And not to do a lip service. Just let her have her moment in time and connect to her. So one thing I would say, yes, my clinics do overrun sometimes, but if a woman has found that time in my clinic as the only time to let her guards down and open up her feelings to me, I don't want to steal that moment away from her.
Okay. If there's one thing every woman is listening today should know or remember about menopause, what would you want that to be?
I would say, don't be ashamed to ask for help. It's not a disease. It's a biological transition you're going through. Asking for help is empowering yourself. And you're not only asking for help for yourself, you will be helping so many other women. They will get the courage to talk about it, to ask help from their friends, family, their doctors. It'll be a norm. So have the courage to talk about it.
Okay. Thank you so much, Dr. Bindiya. It has been an absolute pleasure discussing the menopause. I've learned a lot from this conversation. Thank you so much.
And thank you so much, Moses. And, being a male doctor, you would now understand how this aspect of a woman is equally important as fertility. So thank you for having me over.
Thank you.